Healthcare has been disrupted by technology. Doctors have digital tools that assist them in everyday practice. There is new collaborative tech that helps doctors around the world to guide and perform surgery virtually. Today, medical students can learn more interactively in a controlled and safe environment using virtual reality. Even though new emergent technology has helped improve many aspects of healthcare, patient experience has not been explored as much as users would like to. Today, doctors use brochures, drawings, and 3D models that medical devices company give as merchandising to explain patients about a particular surgery. Even though doctors explain and plan procedures with patients, there are unfilled gaps before entering surgery concerning risk, outcomes, and postoperative care.
I had surgery in my left eye. I didn't really know what would happen right after the surgery. I had a lot of pain that nobody told me about.
My first surgery was completely difficult for me because the doctor didn't give me a lot of information about the surgery.
Another patient said, "I woke up after surgery and found a big suture with staples. For me, it was a surprise. My doctor never told me I was going to have such a horrible scar. Maybe he thought I knew about wound sutures."
So I had a difficult experience because I tore off my ligaments 5 years ago. I was playing football and I tore off my ligaments, and suddenly I went to the doctor and he said, "Oh, you're gonna need surgery." And every time you need surgery, you really want to understand what is gonna happen to you and what happened to me, right? So I was kind of really frustrated because I was asking too many questions and he didn't have any tools that would allow me to understand what happened. And for me, it was kind of frustrating.
There's a need for a better communication with doctors. Furthermore, evidence suggests that good communication is linked to patient health outcomes, patient satisfaction, and better compliance with the health provider. In other words, good communication and education for health providers could mean a decrease in readmission rates and higher client satisfaction scores, and the increase of referred users. In case of physicians, a poor patient education could mean a malpractice lawsuit. This scenario represents an opportunity to target both doctor and patients. WaldemarLink is a medical device company founded in Hamburg, Germany, which its core competencies are knee, hip, tumor, and revision prosthetics. With sales in over 60 countries, Link is among the leading players in the large joint replacement market, reaching top 5 in knee replacement. Link is uniquely positioned to change the game for a better patient experience, improving communicational materials using cutting-edge technology. This change starts with the knee replacement prosthetics market. PatientAR is an augmented reality platform developed for Link to help doctors explain, guide, and review knee replacement surgery plans with patients to improve their education, make them feel safe, and enhance their overall experience in healthcare. Augmented reality can enhance both visual and physical experience for patients. It could be the optimal learning tool that leverages the understanding of abstract and complex concepts and help overcome language barriers between doctors and patients by merging the real world with digital information. PatientAR allows real-time interactivity in an ecological setting, improving concentration and motivation of both sides. This app provides targeted and non-directive suggestions and guidelines that help users to develop skills and knowledge more effectively. To deploy the app, it is necessary to have a tablet or mobile phone with PatientAR installed. Launch the app. A friendly guide will walk you through the steps before beginning the augmented reality experience. Step 1. Patient needs to sign a consent form to authorize Link to keep her medical information. Step 2. The doctor completes a questionnaire with the diagnosis information and upload X-rays as an optional feature. Step 3. Choose the prosthetic to be used in surgery. Pressing Let's Get Started will launch the app and will ask the doctor to log in with its user and password. The doctor will select a previous patient or create a new patient profile. In this case, it is a returning patient, and the doctor will verify its information and select a prosthetic to use in surgery. The app advises the doctor to point the camera 50 centimeters away from the patient to get better results. The patient can visualize the 3D virtual prosthetics in the affected area of his/her body, and the doctor can narrate better the procedure. Also, PatientAR can show the possible outcomes of the surgery. Its potential use would help Link gather patient data in real time to help build case studies for the brand that will leverage doctors' learning around the world. On the other hand, the constant information submitted and feedback from users will help scientists and engineers improve prosthetics and create new products. Also, the data collected will enable the company to plan stock and factory production ahead. The prototype was tested with Dr. Rubén Dulanto, orthopedic surgeon using Link prosthetics for almost 4 years in Peru, and said, PatientAR seems to be a helpful instrument to communicate better with patients. Visual aids help enormously when explaining complicated procedures. Brochure sales reps give us is not enough. Also, Dr. Rajesh Bayle said, we need PatientAR right now. It is fantastic. PatientAR was also explained and tested with patient Layla Oliveira, who had health complications after having 2 surgeries 2 years ago.
I will be completely okay if the medical device company have my medical background, just to show me how it's gonna be the surgery for me. It's gonna give me much more confidence to do this.
PatientAR could be the solution for a better communication and education if doctors are open to take more time with patients and make sure there is a complete and full understanding of the patient. This app could mean to have less consultations per day, but also more satisfied patients. As we know, innovation and emerging technologies bring several ethical implications that must be taken in consideration before starting PatientAR distribution. Augmented reality is a very powerful technology with the capability to influence and manipulate the patient's perception of reality. Technology needs to be accurate, and a physician needs to assess every time it is used. Another issue is patient confidentiality concerning the use of AR or any other technology on our public IP network. This means that it's necessary the assurance of firewalls and the use of anti-malware at both ends of any communication to protect the unauthorized disclosure of personal health data. It is necessary to recognize that new technologies not only can assist doctors' everyday practice, but it can leverage patient experience in healthcare. It's essential for patients to receive high quality and specialized care and feel safe, and the solution proposed for Link could improve that. PatientAR could also represent more rentability for doctors, as the patient will perceive more value with their consultation. Tech and medicine will always belong together, and it is a question of time for medical device companies to upgrade their technology to support patient care for a better experience of their products.